So in the Murrumbidgee Local Health District, we have a number of clinical services that are delivered virtually. And the benefit of delivering across telehealth platforms is that we can be agile and we can run services around the clock and support a large geographical footprint that Murrumbidgee Local Health District covers. Probably the most popular platform that you're all aware of is the COVID hotline, and the benefit of using the local hotline is that we can wrap it up as a one-stop service. So by ringing that 1-800 number 7 days a week, we can schedule screening to see if you have symptoms that require testing, schedule the testing, follow up with your results, and as Lenny mentioned a short time ago, if there's a need to have a medical intervention, rather than having to go to your local emergency department, or if you're struggling to get into your GP, we can provide that service as well. And when we talk about the services we provide out of virtual care, we have a focus on all of our consumer groups, and that includes our clinicians. So our clinicians are also tested at times, as I'm sure you'd all assume, and when we test our clinicians, every day we check on their wellbeing to make sure that they have all the resources they might need, the psychological support, and also we can track their progress with their return to work strategy.
You mentioned your staff. How are they holding up? They're very busy at the moment.
So the staff are holding up well. The staff enjoy a challenge, and in enjoying that challenge, there's opportunities to try new models of care and also to gain new skills. And some of the models of care that we've got are the mobile testing van, the virtual ED clinic, where we can support some of those folk that are worried and can't get into their GP, and also the ability to look at new ways that we can reach out to the consumer and do some of the troubleshooting. So if we have consumers that might have trouble accessing some COVID information, or they might have trouble accessing transport for a medical review and testing, we can get on top of that for them. So it's really about making sure that we're there, we're consumer friendly, and we can move around in a short period of time. And I need to also emphasise the fact that the mobile testing van is on top of the other clinic work that we support, and that's about moving to those hot spots and reaching the gaps between maybe what we're not currently already providing with the local health district and also the primary health network. So forever being responsive, forever looking for new opportunities and further developing our skills in this in treating this disease.
There's been a strong response to the mobile testing, isn't there?
There certainly has, and we're continuing to look for new locations, and we're continuing to make the process more agile. So we support both walk-in consumers as well as consumers that are supported by the mobile hotline. And I guess furthermore to that, we've got a 7-day-a-week model now. This weekend we will be in Wagga, so look out for us at the Apex Park at Lake Albert, and today we're in the Rock and Manga Pla, so looking for where that need is again. And if you're waiting for that mobile testing van, please don't. If you have any symptoms or you have any concerns, ring through to us 7 days a week, and we'll match you up with a testing location.